Now, as the federal government intensifies efforts to strengthen primary healthcare delivery through the Basic Healthcare Provision Fund, questions are emerging about how effectively these funds are being utilized and what more needs to be done for the scheme to truly impact the lives of ordinary citizens. Trust TV's Abdulaziz Ibrahim spoke to residents about the initiative and now reports.
The Basic Healthcare Provision Fund, or BHCPF, was established to improve access to quality health care for Nigeria's poorest and most vulnerable citizens. In Kano, the funds are disbursed to health facilities through two main channels. 300,750 naira is released quarterly from the State Primary Healthcare Board to 484 facilities, including this one at Sharada. 570 naira per beneficiary is sent monthly through the Kano State Contributory Healthcare Management Agency. The aim is to ensure that pregnant women, the elderly defined in Kano as those above 60 years, children under 5, persons with disabilities, and other vulnerable groups receive essential healthcare services at no cost. Each ward has a ward development committee responsible for supervising implementation and ensuring accountability. Health workers here say the funds have enabled them to provide essential drugs, improve facilities, and hire ad hoc staff to meet growing patient needs.
Because we have a lot of patients in Sharada that we used to give them help, how to have a good treatment and the drugs also at the right time. And also we have, in terms of some of old man and child, I used to give them free drugs.
For some elderly residents, the impact has been life-changing.
I had been sick at home for some time before being brought to this hospital. I received all the necessary tests and treatment free of charge.
Hassan Gama works for a civil society organization monitoring the project.
We go to facilities and then we follow that money and see what are they using the money for. And good enough, a lot of our facilities have been using the money because, for example, there are some facilities that we go, there are challenges of, they have the challenges of not having electric supply, and they bought solar power for that facilities. And there are some facilities that they have problem of roofing. They use that money to repair their facilities. And then some of them, they employ temporary staff for them to be paying them.
Despite the billions allocated, many Nigerians still struggle to access quality health care. He believes sustained oversight, community participation, and private sector collaboration are essential to achieving wider health coverage.
Because the system said the federal government will be putting 1% from its consolidated revenue fund. But it said other development partners, other private institutions, private companies can come in. So you can see it now. Let the private companies and donor partners come in and support this program. We should not wait for development partners. We should support the system. For us now, let us be going out, conducting monitoring. You know, in Nigeria system, if you want it to work, you have to express action on monitoring. And I'm calling for the government also, for them to put more money on monitoring.
With effective monitoring, transparency, and stronger private sector support, the Basic Healthcare Provision Fund can move Nigeria closer to a system where income no longer determines who receives proper health care. Abdulaziz Ibrahim, Trust TV News, Kano.